Bismillahirrahmanirrahim. I am Dr. Ammad Waheed Khan, PGR MPH Community Medicine Department, King Edward Medical University. My supervisor is Professor Dr. Saira Afzal. Today, the topic of my presentation is pertussis, learning outlines, epidemiological triad, reservoir, source of infection, mode of transmission, level of prevention, surveillance system, recent advances, MCQs. Learning outcome. In the end of session, participant will be able to describe clinical features, treatment complications, and prevention of whooping cough. Pertussis whooping cough is a acute bacterial infection. Respiratory tract involved trachea, bronchi, bronchioles. Typical cough 1 to 2 months. Chinese called this 100-day cough. This is a global scenario of pertussis. In 2018, there were 151,000 cases of pertussis globally. 86 were covered by a vaccine. 129 countries by 2018, 129 countries had reached at least 90% coverage of DTP3 vaccine. In 2019, it was estimated that there were globally 1,17,000 deaths. Death rate were highest in children aged 28 to 36 months, but decline in this population by 56.1% between 1990 and 2019. Whooping cough status in Pakistan. According to a study carried out in Pakistan in 2016, the disease incidence was found to be 3.96 in 1,000 infants. Share of children aged 12 to 23 months who are immunized against diphtheria, pertussis, and tetanus in Pakistan from 2012 to 2019. Occurrence in the 20th century, this disease was common and major cause of childhood mortality. Before pertussis vaccine, more than 2 lakh cases were reported. Widespread use of vaccine incidence has been decreased to 80%. Epidemiological triad agent factor uh, agent is Bordetella pertussis, gram-negative bacterium requiring special media for isolation, toxin mediated disease. Host factor age infant and preschool, highest incidence below 5 years. Sex more among female than male children. Immunity recovery or adequate immunization is followed by immunity. Environmental factors case frequently occur in winter spring overcrowding. Chain of transmission reservoir infect only man. Case of pertussis source of infection occur abundantly in nasopharyngeal and bronchial secretions. Mode of transmission through droplet nuclei. Direct contact with the infected person. Role of fomites are very small. Incubation period it is 7 to 21 days, does not expand more than 3 weeks. Secondary attack rate average 90% in non-immunized household contact. Pathogenesis bacteria attached to the cilia of the respiratory epithelium produce toxin that paralyze the cilia, cause inflammation of respiratory tract. Clinical feature three phases are seen in whooping cough: catarrhal phase, paroxysmal phase, convalescent phase. 1 to 2 week, there would be mild fever, cough, rhinorrhea, and lacrimation. 2 to 3rd month, paroxysmal cough, spasmodium, post-tussive vomiting, and 1 to 3 weeks, gradual reduction in symptoms. At what stage is pertussis contagious? Infected people are most contagious up to about 2 weeks after the cough begin. Antibiotics may shorten the amount of time, Someone is contagious. Babies and children's pneumonia, lung infection 23%, convulsion 1.1%, apnea 61%, encephalopathy 2.3%, and die 1%. Teens and adult weight loss 33%, loss of bladder control 28%, unconsciousness 6%, rib fracture from severe coughing 4%. Levels of preventions. Primary prevention is to educate parents, health promotions, wear mask, avoid contacts, develop habits of cleanliness, cover your cough. CDC recommends practicing good hygiene to prevent the spread of respiratory illness. To practice good hygiene, you should cover your mouth and nose with a tissue when you cough or sneeze. Put your used tissue in the waste basket. Cuff or sneeze into your upper sleeve or elbow. Note your hands. If you do not have the tissue, wash your hands often with soap and water for at least 20 seconds. Use an alcohol based hand rub if soap and water are not available. Produces vaccine. Two kinds of vaccines used today help protect against the whooping cough, both of which also protect against other disease, diphtheria, tetanus, and pertussis, which called DTaP vaccine. Tetanus, diphtheria, pertussis, Tdap vaccine. DTaP is a vaccine that helps children younger than age 7 develop immunity to three deadly diseases caused by the bacteria diphtheria, tetanus, and whooping cough. Tdap is a booster immunization given at the age of 11 that offer continue protection from those diseases for adolescents and adults. Prefer injection site of DPT is it is currently recommended that diphtheria, tetanus, pertussis immunization should be administered to young infants 2 to 6 months old in the anterolateral thigh and to the older children 4 to 5 years old in the deltoid muscle. Whooping cough vaccinate to protect who needs whooping cough vaccine, pregnant women, infants, young children, preteens and teens, adult of all age. Whooping cough is most deadly for infants. Get vaccinated, protect yourself, protect the babies. People who all ages need whooping cough. DTaP for young children age 2, 4 and 6 months, 15 through 18 months, 4 through 6 year. TTAP for preteen 11 through 12 month 12 years. TTAP for pregnant women during the 27th to 36th week of each pregnancy. TTAP for adult anytime for those who have never received it. These are the guidelines from CDC. National immunization schedule at birth. The vaccine given is BCG, OPV 0, and Hep B at 6 weeks. DPT 1, OPV 1, or Hep B. 10th week, DPT 2, OPV2 Hep B. 14 weeks, DPT 3, OPV 3 Hep B. 9 months, measles with a vitamin A. 16 to 24 months, DPT booster first, OPV booster. 5 years DPT booster second, 10-year tetanus toxoid, and 16-year TT. Do pertussis vaccine protects for a lifetime? Pertussis vaccine are effective but not perfect. They typically offer good level of protection within the first 2 years after getting the vaccine, but then protection decrease over time. Public health expert call this When winning immunity, similarly, natural infection may also only protect you for a few years. In general, DTaP vaccine are 80% to 90% effective. CDC estimate that in the first year after getting vaccinated with DTaP, it protect about 7 out of 10 people who receive it. There is a decrease in effectiveness in each following years. Vaccination in pregnancy. Vaccination of pregnant women is effective in preventing disease in infant too young to be vaccinated. National program may consider vaccination of pregnant women with pertussis containing vaccine as a strategic additional to routine primary infant pertussis vaccination in countries or setting with high or increasing infant mortality for pertussis. Vaccination in breastfeeding. Breastfeeding is a safe after getting the whooping cough vaccine. A mother can and should get the whooping cough vaccine if she plans to breastfeed or is currently breastfeeding. Maternal vaccination, antenatal vaccination against pertussis induce high antibody concentration in pregnant women, which are efficiently transferred to the fetus and protect newborn. This strategy is safe with no evidence of adverse pregnancy. Recommendation in 2011, the Advisory Committee on Immunization Practices of the Central Centers for Disease Control and Prevention in the USA recommended the combined tetanus toxide, reduced diphtheria toxide, and acellular pertussis vaccination in the third trimester of pregnancy between 27 and 36 weeks of pregnancy for women who had never received a Tdap vaccine prior to pregnancy. This recommendation was modified in 2012 to include all women regardless of prior receipt of Tdap and with every pregnancy following evidence of waning vaccine immunity after vaccination in the first trimester of pregnancy. No pertussis vaccine available for infant and birth. There are no pertussis vaccine licensed or recommended for newborns at birth. The best way to prevent pertussis in the young infant is by vaccinating the mother with Tdap during pregnancy, encouraging people around the infant to be up to date with their pertussis vaccine, administering the childhood Tdap series on schedule. These are the current recommendation of CDC. Diagnosis through lab, PCR, culture, serological ELISA. Prompt treatment if clinical history, sign, and symptoms strongly suggest disease, then immediate start treatment. Use of antibiotic erythromycin, clarithromycin, azithromycin, more if age is one above a month. For infants, above 1 month of age, azithromycin is preferred for treatment. Post-exposure antimicrobial prophylaxis, erythromycin, azithromycin, and clarithromycin. Surveillance and reporting. Pertussis is nationally notifiable, and clinicians should notify the appropriate health department of all identify cases to limit transmission in setting with infant or other who may transmit pertussis to infant, identify and prevent break, identify contacts of cases and recommended appropriate prevention measure including exclusion, antibiotic prophylaxis and immunization, monitor the effectiveness of immunization programs and vaccine. Recent advances. Pertussis is high risk group an overview of the past quarter century. Abstract infectious diseases can impact chronic medical conditions. However, it is currently not clear how pertussis correlate with pre-existing or underlying disorders, we reviewed literature from the last 25 years to describe the burden and the impact of pertussis infection in specific risk group in individual age more than 11 years. Our literature search returned 543 hits, of which 18 were eligible for this review. Adolescent and adult were with underlying conditions such as asthma, chronic obstructive pulmonary disease, or obesity are potentially at increased risk of pertussis infection. Immunodeficiency and smoking have been associated with worsened pertussis symptom and an increased pertussis related hospitalization rate. In patient with pertussis and pre-existing asthma or COPD, symptoms were worsened and healthcare costs were consequently increased. Further effort are needed to close the knowledge gap and to understand the burden of pertussis in at-risk adolescent and adult population to help inform vaccination strategy and recommendations. MCQ. MCQ number 1, pertussis is an acute bacterial infection of respiratory tract. Which of the following is not true in relation to pertussis infection? Option A, most infection during catarrhal stage. Option B, secondary attack rate is 90%. Option C, subclinician clinical cases source of infection. Option D, infants are susceptible from birth. Option E is pregnant women are susceptible.
B.
C is the right answer. Question number 2, whooping cough or pertussis can be a serious disease for people of all ages, but especially for babies. Whooping cough vaccines offer the best protection against this very contagious disease. All of the following are correct regarding pertussis vaccine except option A, pertussis vaccine does not provide lifelong immunity. Option B, pertussis vaccine is safe for lactating mothers but not for the pregnant woman. Option C, pertussis vaccine offers good protection for first 2 years of vaccination, then the effect start declining. Option D, pertussis vaccine is not available or recommended to newborn baby by CDC. Option E, booster dose is required at 4 years of age.
B.
E is the right answer. Question number 3. Pertussis is a highly contagious disease severely affecting the children less than 1 year of age. The best way to prevent it is immunization. Following statements are true regarding control of pertussis, except option A, isolation of cases, option B, passive immunization of contacts, option C, concurrent disinfections of nose and throat discharges, option D, 14-day course of erythromycin for contacts, option C, three phases are seen in whooping cough.
D.
Yes, P is the right answer. Question number 4. An old month baby was brought to the emergency department with complaint of paroxysmal cough for more than 2 weeks, followed by vomiting, leading to apneic spell. Her lab investigation were done to confirm the suspicion of pertussis. Which of the following investigation is readily available in most of the lab with high sensitivity? Option A is PCR, option B blood culture, option C ELISA, option D urine culture, option E is throat web swab.
E. Throat swab.
B is the right answer. Question number 5, pertussis vaccination during the pregnancy could protect infants against pertussis disease before the routine vaccination? Which of the vaccine is given during the pregnancy and when? Option A is DTaP first semester trimester. Option B is DTaP third trimester. Option C DTaP third trimester. Option D DTaP third trimester and DTaP at second trimester.
C.
Is the right answer. Question number six. Pertussis vaccine consists of acellular pertussis toxin available in combination with diphtheria and tetanus vaccine. Which of the following is not true about the vaccine administration? Option A, people of all age do not need pertussis vaccine. Option B, it is a vaccine of choice for children 6 weeks through 6 years of age only. C is booster Tdap is given at 11 years. D, an adult. In adult Tdap, anytime who had never received. E, no vaccine available for new birth at birth.
C.
D is the right answer. Question number seven. DTaP and DTaP are two kinds of vaccine used today help protect against the whooping cough, both of which also protect against other disease. Which of the following is true regarding their administration? Uh, DTaP help children younger than age 7 develop immunity against the diphtheria, tetanus, and whooping cough. DTaP is given to children older than 11 years of age as a booster dose, while Tdap is given to children up to 6 years of age. Any of them can be administered to child of any age. DTaP is only for pregnant women and adult, and DTaP is only for newborn babies. B is the right answer. Question number eight. A 2 year child with a history of contact with produces develop bouts of cough, inspiratory whoop, and post-fusive vomiting. Which of the following phase is most contagious? Option A is catarrhal stage, B is paroxysmal stage, C is post-paroxysmal stage, D is incubation stage, and E is latent stage.
B.
C is the right answer. Question number nine. Pertussis in infant is often severe, and infant are more likely than older children or adult to develop complication. The most common complication of pertussis and the cause of most pertussis related death is option A, bacterial pneumonia, option B, encephalopathy, option C, epistaxis, option D, syncope, and option E is hypotension. A is the right answer. Question number 10. A 4 year child in a family XYZ develops certain symptoms. The doctor got his investigation done and labeled him as a confirmed case of pertussis. Now his family member are concerned about catching the same infection as none of them is vaccinated. What is the secondary attack rate in non-immunized household contacts? Option A is 90%, option B is 100%, option C 50%, option D is 80%, and option E is 70%.
A.
E is
90%.
the right answer. This is the key of the MCQs. These are the references through which this presentation has been made. Here is the link of YouTube channel where this presentation has been uploaded. Thank you.
Thank you very much, Dr.